Hello and welcome to another video from Crown Point Optometry. Today I'm going to be doing a little bit more of a general video about, first of all, how to prepare for your eye exam and also what to expect in your eye exam, just because some people either haven't had an eye exam before or don't kind of know what's behind some of the reasons why we do what we do. So first of all, to prepare for your eye exam, there's a few things that you'll want to do. One of them is to make sure that you bring in any glasses that you currently wear. Even if they're broken or scratched, or even if you don't like them anymore, even if the prescription is 10 years old, because it's useful information for the eye doctor to have what you're wearing existing, to know how much of a change it will be, and to know kind of what to expect when they start the exam. Another thing you're going to for sure want to bring with you is a list of any medications that you may be taking, or at least to know what medications you take. The reason being is that there's certain eye conditions that are associated with certain diseases, for example, diabetes. So it would be good to know if someone's taking medication for that, to know, what to expect in terms of checking for complications for that. Another reason is that there are certain medications, for example, a medication called Plaquenil, which can have side effects on the eyes, so we'd want to know that someone's taking that to do the appropriate test to make sure that that's not the case. Also, there's certain allergies or contraindications to things that your eye doctor may prescribe, so that's why we want to know, kind of have as complete a list as we can of medications before we start. Another thing that you're going to want to do is check for any insurance policies that you may have that you may be using for your eye exam, because knowing ahead of time what to expect for that prevents any kind of unpleasant surprises when you arrive for your appointment. So now, once we've arrived to the big day and you're there for your appointment, there's a few things to expect. First of all, we need to make sure that we have up-to-date contact information, because if we do a referral, or also if you do for your next appointment, we're going to want to make sure that we can make that contact. Another thing that we'll do is do a couple of preliminary tests, both measuring the glasses and doing some preliminary tests on the eyes, like checking the pressures and things like that, just to make sure that things are okay before the main part of the eye exam starts. Now, some people are a little bit intimidated by the infamous air puff, so this is a way of checking for glaucoma. But it is important. There are alternatives to the air puff, ways of checking the pressure if need be, but it is important to take the pressures in some way because we want to make sure that there's no glaucoma or other reasons for high pressures in the eye, because that can ultimately cause some vision loss. During the main part of the exam, a few things will happen. Take the vision, normally with the glasses. If you wear glasses for distance, we normally take the vision. Check the alignment, to make sure that there's no problems with an eye turning in or out. Make sure that things like pupils and eye movements are normal, and make sure that there's no side vision issues. We want to just rule out anything that could be life or sight threatening. Then we would go along to check the glasses. We want to make sure that both distance and near for each eye are good. When we do expect to test it individually for each eye, because that way people are more sensitive and we can make sure that each eye sees as well as it can. So then sometimes you may be asked to dilate the pupils. So dilating the pupils involves putting an eye drop in, and then the pupils get big after a period of time, 10 or 15 minutes or so, and that's for a couple of purposes. One is that with a large pupil, you can see what's behind it in terms of checking for cataract or any problems with the retina a lot easier. Also, in some cases, prescriptions can fluctuate quite a bit from moment to moment, so the drops also help stop those fluctuations. So in some cases, we may need to dilate the pupils as well to get a proper eye exam. Then usually the last part of the eye exam involves checking the health of the eyes with a microscope to make sure that there's no bleeds or swelling or glaucoma or other complications, scarring or anything like that at the front or the back of the eye. And then, we'd go over the optometrist would go over the results and go for any follow-up or any referrals that would be needed, and then kind of explain what to expect next in terms of when the next appointment should be or anything that should be done in terms of changing glasses or anything like that between now and then. So hopefully that demystifies the process a little bit about preparing for and having your eye exam. So if you have any other questions, feel free to contact the office. Otherwise, thank you very much for watching, and we'll see you soon. Thank you.